Hi, I'm Dr. Kosabevsky here at the Osteopathic Center with our newest location in Jupiter, and I'm going to talk about osteopathic manipulation, otherwise known as OMM or OMT for short. So really the first question we get is how do you learn this and where does it come from? So when you go to an osteopathic medical school, you spend about 8 hours a week for 2 years learning these techniques. And there's a wide range of these techniques. There's hard, aggressive techniques, and then there are the very soft, gentle patients are like, what are you doing? I feel like you haven't done anything for the last 30 minutes techniques. So let's talk about the hard techniques first. They're known as HVLA, and those are the techniques that when you feel your back get popped or your pelvis get crunched or any of those things that lead to popping, crunching, that's called HVLA. And the other hard technique is called muscle energy. And that's where the practitioner who's doing the technique on you will actually take your limb, take your back, whatever it is, and put it into position, have you press against them. And those are pretty effective techniques. They tend to get you where you need to be. But then we also have the soft techniques. And those are techniques that it's called 10-finger osteopathics in some cases. And basically what you're doing is you're just putting your hands on. The patient doesn't feel much. They just feel very gentle pressure. And what we're focusing on is moving the muscles, ligaments, tendons to try and find a neutral point. Because what we're really looking for is what is the source of your pain? Why is your body no longer in a neutral position? Because that's where the pain is coming from. Your body feels something uncomfortable, it's trying to compensate, and it starts throwing things out and out as you go. And so when they're out, we're not saying that it's dislocated. If it was dislocated, you wouldn't even be able to use that part of your body. It would just be hanging there. What we're talking about is a term called subluxation, where you could have your joint looks like this with that, let's say your rib head sitting in there. And instead of this being normal, it's sitting just like that, just a little bit out. And when it's doing that, it's pressing on a nerve that happens to be running down here. Or it's just uncomfortable because it's not going in and out like it should. And those are things that could lead to the source of your pain. Another great example is having low back pain or sciatica with that sharp pain just shooting down your leg all the time. When you sit, when you stand, it just gets worse and worse. And so that's something that we can approach with soft, gentle manipulation. A lot of times your sacrum, which is the bottom part of your spine, and it's kind of shaped like a triangle, and it's just sitting a little bit low or a little bit to the left. And what's happening is it's straining one of the muscles called the piriformis, or it's straining your SI ligaments, the sacral to hip ligaments. And what's happening is that as you're straining those muscles or those ligaments, you're putting a lot of tension on that sciatic nerve and just causing that uncomfortable pain. So back to training. So everyone, when they go to osteopathic school, they spend 8 hours a week for 2 years. My story is a little bit different. My dad up in New Jersey has been doing this since before I was born. And so when I was around 11, 12 years old, he started teaching me. At first, he taught me on family members, patients his that were willing to be seen by me. And then as time went on, he started teaching me more and more. And when I was 18, he started sending me the courses to learn manipulation. So by the time I started medical school at 2021, I was already pretty comfortable with manipulation. And actually, while I was in medical school, the faculty there asked me to help teach the lower classes osteopathic manipulation. So I spent about a year teaching OMM. So those are some stories. Other things that we can help with osteopathic manipulation are those tension headaches. You have all that tension sitting up in your upper shoulders, your lower neck, and what's happening is that crunching down to those muscles is just causing some shifts. It's pulling tension on the back of your head, and that's what causes those headaches. And those frontal headaches, you actually have something called fascia, which is connective tissue that runs from your forehead all the way across your scalp back, and it meets where your neck muscles attach. And so that's a really big source of those frontal headaches. So what we do is we try and relax those muscles. We try and bring them to a neutral point. And a big part of that is what I call cell phone neck. Everyone's on their phone nowadays looking like this, and that's just straining all of these muscles. So we're just trying to find that neutral point and bring you back to a comfortable, safe position for your body, and we try and train your body to stay in it. Other things that we can help, or you ever get that rib that just feels like it's stuck out all the time and you just can't ever get it to go back in? Like I brought up earlier, it's probably sitting just a little bit out. And so what you want it to do is just to bring it back to its neutral point with a little bit of gentle manipulation and just let it slide back into where it should be. Those are just a couple examples. Really, we can approach anything painful that you have musculoskeletal wise. And so the main techniques that we're using in soft, gentle approaches are neurofascial and myofascial approaches. We're working on the fascia, which is the connective tissue around the nerves, around your muscles, and sometimes that fascia can get strained and get a little crinkled. And so what we're trying to do is smooth it out to take the pressure off the nerves or take the pressure off the muscles. We can do balanced ligamentous tension, which is you have a muscle between two tendons, and what we want to do is find its neutral point. Why is one side of it being strained more than the other? Try and bring it back. Another thing that we are very good at here is craniosacral therapy. And so you have your spinal column, that's attaching your head to your sacrum. And there's muscles that run all the way from your head down to your sacral bone at the bottom of your spine. And so we're trying to, once again, find that neutral point. Another thing we have here is counter strain. And counter strain, its whole purpose is to put you in a neutral position for about a minute and a half to try and let your body realize it's no longer being strained until it can relax and let that pain go. And so this is something that we'll really save for another talk, but we'll oftentimes have patients come in weekly or monthly with pain, and the pain will go away for a bit, but it'll keep coming back. And so what that's kind of telling us is that we're finding this patient's neutral and their pain goes away, but their body is just no longer strong enough. Those ligaments and tendons aren't strong enough to hold that position anymore. So what happens is that whatever painful part of this slowly slips back to its unneutral point. And so we can do regenerative injections to try and strengthen those ligaments and tendons and create a long-term approach, because what we don't want here is to have you come back for the rest of your life every week or every month. We want to get you better and make sure that you stay better.